Ever wondered what secrets lie hidden within the human body? From sudden unexplained illnesses to bizarre medical conditions, these mysteries have both baffled and fascinated us. Today we dive into 5 of the most astonishing medical stories ever documented. Let's unravel these puzzles together. On a seemingly ordinary evening in February 1994, Gloria Ramirez was rushed to an emergency room in Riverside, California. Dubbed the Toxic Lady by media, her case quickly became one of the most perplexing medical mysteries of the decade. When Gloria, suffering from advanced cervical cancer, was admitted, nothing seemed out of the ordinary, until the staff began to experience strange symptoms. As they attempted to treat her, several nurses and doctors became dizzy and faint. One even ended up in the ICU. The situation escalated so rapidly that the hospital declared an internal emergency, suspecting a hazardous material might be involved. The symptoms reported included nausea, dizziness, and an unusual fruity smell that some described as emanating from Gloria's body. More intriguingly, her blood had oily manila-colored particles floating in it, which no one could initially identify. This bizarre occurrence led to a flurry of theories. Was it a chemical contamination, a drug reaction, or something entirely unknown? Researchers at Lawrence Livermore National Laboratory eventually proposed that Gloria might have been using a skin cream containing dimethyl sulfoxide, DMSO, a solvent used as a powerful degreaser which could have built up in her system due to her urinary blockage. They theorized that the DMSO in her system might have converted into dimethyl sulfone and then to dimethyl sulfate, a highly toxic compound, under the conditions created by the oxygen administered in the ER. This hypothesis, however, has been contested and remains unconfirmed, leaving room for ongoing debate and investigation. Despite the extensive studies, no definitive conclusion has been reached about the exact nature of the substances found in Gloria Ramirez's system, or the cause of the mass incapacitation of the hospital staff. The impact of Gloria's case on medical and emergency protocols was profound. It led to increased hospital safety measures, including better hazardous material handling, more rigorous training for emergency personnel in chemical exposure scenarios, and enhanced protocols for dealing with mass casualty incidents that involve potential toxins. In the mid-19th century, an extraordinary incident befell Phineas Gage, a railroad construction foreman, which astonishingly altered the course of neuroscience. One day at work, an accidental explosion sent a 3-foot-long iron rod shooting straight through Gage's skull. Miraculously, he survived. But the Gage who emerged post-accident was starkly different from the man he once was. The accident occurred in 1848 while Gage was compacting explosive powder with the iron rod. The powder ignited, and the rod pierced through his left cheek, exited the top of his head, and landed several yards away. Shockingly, Gage was conscious and walking minutes after the incident, even speaking and sitting upright during the 3/4-mile cart ride to the nearest doctor. Medical professionals were astounded by his survival. Dr. John Martin Harlow, the physician who treated him, documented the case meticulously. Initially, Gage's physical recovery was promising, though he faced infections and significant challenges. However, the more profound effects were on his personality. Previously a well-regarded, hard-working and amiable man, Gage became fitful, irreverent and profane, showing little regard for social conventions or the feelings of others. This drastic change puzzled those who knew him. From a neurological perspective, the iron rod had destroyed much of Gage's frontal cortex, the area of the brain we now understand to be crucial for decision-making, emotional regulation, and personality. His case provided one of the first pieces of evidence linking brain anatomy to personality and cognitive function, challenging the then existing notions about the brain's operation and the localization of its functions. Imagine having a blood type so rare that it's termed golden blood. This isn't fiction, but the reality for a few extraordinary individuals around the world, carriers of the Rh null blood type. Among them is a man whose identity remains anonymous for privacy, but whose blood can save lives across the globe. Rh null is one of the rarest blood types on Earth, with fewer than 50 known carriers since its discovery in 1961. This blood type is called golden not because of its color, but because of its invaluable ability to be transfused into any patient with rare and complex blood type combinations without causing adverse reactions. The man with the golden blood has donated blood regularly, impacting countless lives. His rare blood is stored in blood banks and used in extreme cases where patients have no other options. This rarity and utility make Rh null incredibly valuable in medicine. Hospitals and international blood banks consider it a crucial resource for emergency transfusions and treating severe blood disorders. However, the existence of such a rare blood type raises significant ethical questions. The demand for Rh null blood places immense pressure on the few individuals who can donate it. They are often approached by global health authorities and are asked to donate regularly, which brings up concerns about the rights and well-being of these donors. There is an ongoing debate about the balance between the needs of patients and the rights of donors, especially when donors possess something as rare as Rh null blood. Additionally, the use of such rare blood highlights issues of accessibility and medical equity. Who gets access to this golden blood in critical situations, and who decides? These ethical dilemmas underscore the complexities of medical ethics in the face of rare natural resources like Rh null blood. In the hills of Kentucky, a family with a striking characteristic puzzled everyone. They had blue skin. Known as the blue fugates of Troublesome Creek, their unusual blue tint set them apart, sparking both curiosity and medical interest. The blue fugates first gained attention in the 1960s when doctors discovered that their blue skin was due to a rare genetic condition called methemoglobinemia. This condition results from an excess of methemoglobin, a form of hemoglobin that is unable to release oxygen effectively to body tissues. In the fugates, a recessive gene that promotes the production of methemoglobin was passed down through generations, exacerbated by the isolated community and intermarriage which limited genetic variability. Medical resolution came when a hematologist named Dr. Madison Cowain III took an interest in their case. He treated the family with methylene blue, a dye that helped their blood return to a normal, healthy red by converting methemoglobin back into hemoglobin. This treatment was remarkably effective, gradually reducing the blue coloring of their skin and greatly improving their quality of life. The story of the blue people of Kentucky has had a lasting impact on both genetic research and public perception of genetic disorders. It provided a clear, real-world example of how genetic traits can be passed through generations and how they can be altered by geographical and social isolation. For the scientific community, it highlighted the importance of understanding genetic diversity, particularly in isolated populations, and advanced studies in genetics and hereditary disorders. Meet Wim Hof, also known as the Iceman. He's not just a thrill seeker, but a man who has redefined what's physically possible, challenging our understanding of the human body's limits against extreme cold. Wim Hof's journey began in the Netherlands, where personal tragedy and a natural inclination towards extreme temperatures led him to discover and refine his ability to withstand cold. His techniques, developed through years of practice and experimentation, were born from a blend of necessity and curiosity. The core of the Wim Hof method revolves around three main pillars: cold exposure, breathing techniques, and meditation. Cold exposure starts gradually, from cold showers to ice baths, teaching the body to withstand lower temperatures. The breathing techniques, which involve controlled hyperventilation followed by breath holding, are designed to increase oxygen levels in the blood, theoretically enabling one to endure cold better and influence the body's pH level. Meditation helps to fortify mental focus and control, essential for mastering the physical aspects of the method. Researchers have taken a keen interest in Hof's claims, leading to several scientific investigations. Studies have shown that through his method, Wim Hof can voluntarily influence his autonomic nervous system, Something previously thought impossible, this capability has implications for enhancing immune response and reducing inflammation, suggesting potential benefits that extend well beyond withstanding cold, such as improving immune system resilience and potentially easing symptoms of autoimmune diseases. The personal impact of his method is also noteworthy. Many of Hof's followers report significant improvements in their physical and mental health. Testimonials range from enhanced endurance and pain tolerance to reduced stress levels and quicker recovery times. These stories provide anecdotal, yet powerful insights into how the method has transformed personal health and wellness. Through his workshops and training programs, Wim Hof has not only demonstrated the power of his method, but also inspired thousands to explore the limits of their own bodies, showing that the potential for human resilience might be far greater than we ever imagined. Exploring these medical mysteries not only deepens our understanding of science, but also connects us to the human stories behind the discoveries. Each case, from Wim Hof's remarkable control over his body to life-saving golden blood, challenges what we know about the human body and inspires further exploration into the unknown corners of medical science. These stories push the boundaries of our knowledge and spark conversations about ethics, progress, and the limits of human capability. If you found these stories as fascinating as we do, don't forget to like and subscribe for more insightful content. Have any thoughts or personal experiences with medical mysteries? Share them in the comments below. We'd love to hear your stories.